Everyone, this is Nurse Anna coming to you from nursestudy.net, and today we're going to be discussing asthma, nursing diagnosis, and nursing care plans. Asthma is sometimes referred to as reactive airway disease or bronchial asthma. There is no cure for asthma, but the symptoms can be managed and controlled effectively. Asthma can interfere with the patient's activity of daily living and also put the client at risk for asthma attacks. Some of the common signs and symptoms of asthma that we should see is shortness of breath, chest tightness or chest pain, wheezing upon exhalation, especially in children, coughing, phlegm. Most asthma cases are non productive though. Sleeping problems due to coughing or breathlessness, and tiredness or fatigue. Signs and symptoms of asthma attacks would include nonstop coughing, severe wheezing on both inhalation and exhalation, rapid breathing, chest pain or pressure, retractions, tightened neck and chest muscles, difficulty talking, feeling of anxiety or panic, pale, sweaty face, cyanosis, where you'll see blue lips or fingernails. Asthma may be worsening if the patient experiences the signs and symptoms or has asthma attacks more and more frequently. Now we're going to look at causes of asthma. The exact cause of asthma is unknown. However, experts believe that asthma is caused by a combination of genetic and environmental factors. Asthma attacks or flare ups may be triggered by different environmental factors. Exercise induced asthma may occur if the patient's exercise and physical activity results in an asthma attack. This becomes worse if the patient is exercising in a cold environment where the air is dry. Allergy induced asthma happens when airborne substances such as mold spores, pollen, insect waste, pet dander, or skin particles trigger the asthma. Occupational asthma occurs in the workplace where gases, dust, chemical fumes, or other workplace irritants may be present. Other triggers of asthma include respiratory infections, air pollutants such as cigarette smoke, vehicular smoke, emotional stress, some medications such as aspirin and NSAIDs like ibuprofen and naproxen, and some sulfites and preservatives. So, next, we're going to discuss some complications of asthma. One, sleep deprivation or interference in activities of daily living, ADLs. Two, permanently narrowed airways that causes shortness of breath. Three, frequent hospitalizations due to asthma attacks. Four, medication related side effects. Inhaled steroids may cause poor growth in children and decreased bone density. Next, we'll look at some of the ways that asthma is diagnosed. One would be physical examination, auscultation of wheeze, inspection of ear, nose, and throat and airways, looking for any chest retractions or signs of cyanosis, checking for respiratory rate and oxygen saturation levels. Another would be lung function tests, spirometry, and peak flow meter. This is usually done before and after taking a bronchodilator. Imaging exams like a chest x ray, allergy testing, sputum test to check if there's any eosinophils in the sputum, and finally a nitric oxide test to check for elevated nitric oxide levels, which are indicative of narrowed airways. Next, we'll look at some treatments for asthma. We're going to look at some long-term asthma medications, and these are used on a daily basis to control asthma symptoms and prevent an asthma attack. These include inhaled corticosteroids, leukotriene modifiers, combination inhalers. These are like combined corticosteroids and long-acting beta agonists, such as Advair. Theophylline. This is another medication and it relaxes the airway muscles, allowing the airways to remain open. Theophylline does require blood tests to determine toxicity levels. We can also use some quick relief or rescue medications. These medications are used during an asthma attack for short term relief. They may also be used prior to exercise. We could also use a short acting beta agonist, such as a bronchodilator like albuterol. Anticholinergic agents are also used. They're also used in chronic bronchitis and emphysema. You would see something like Atrovent used for this. Oral and intravenous corticosteroids alleviate airway inflammation. These include prednisone and methylprednisolone, or also called solumedrol. Another treatment could be allergy medications for allergy induced asthma. And now we'll discuss some nursing diagnosis for asthma. I'm only going to go through two here and their care plans, but if you go to nursestudy.net, we have, I think, at least five nursing care plans complete with rationales and interventions. So go to nursestudy.net for more nursing diagnosis and nursing care plans for asthma. Okay, so nursing care plan number one for asthma would be ineffective airway clearance related to asthma as evidenced by shortness of breath, wheeze, O2 sat of 85%, respiratory rate of 25, and a productive cough. For the desired outcome, the patient will be able to maintain airway patency and improved airway clearance as evidenced by being able to expectorate phlegm effectively. Respiratory rates between 12 and 20 breaths per minute, oxygen saturation within the target range, and verbalize ease of breathing. Intervention. Assess the patient's vital sign and characteristics of respirations at least every 4 hours. Assess breath sounds via auscultation. Rationale? To assist in creating an accurate diagnosis and monitor effectiveness of medical treatment. Wheeze is one of the important signs of asthma. Intervention. Encourage coughing and suction secretions as needed. Rationale? To help clear thick phlegm that the patient is unable to expectorate. Intervention. Administer supplemental oxygen as prescribed. Discontinue if oxygen level O2 sat level is above the target range or as ordered by the physician. Rationale: to increase the oxygen level and achieve an O2 value within the target range. Intervention. Administer the prescribed asthma medications like bronchodilators, steroids, or combination inhalers and nebulizers. Rationales: bronchodilators will dilate or relax the muscles in the airways, and steroids to reduce the inflammation in the lungs. Intervention. Elevate the head of the bed and assist the patient to assume a semi-Fowler's position. Rationale: head elevation and proper positioning help improve the expansion of the lungs, enabling the patient to breathe more effectively. And for another nursing care plan for asthma, we could use activity intolerance related to imbalance between oxygen supply and demand, secondary to asthma as evidenced by fatigue, overwhelming lack of energy, verbalization of tiredness, general weakness, and shortness of breath upon exertion. Desired outcome: the patient will be able to demonstrate active participation in necessary and desired activities and demonstrate an increase in activity levels. Intervention. Assess the patient's activities of daily living, as well as actual and perceived limitations to physical activity. Ask for any form of exercise that they used to do or want to try. Rationale: to create a baseline of activity levels and mental status related to fatigue and activity intolerance. Intervention. Encourage progressive activity through self care and exercise as tolerated. Explain the need to reduce sedentary activities such as watching television and using social media for long periods. Alternate periods of physical activity with 60 to 90 minutes of undisturbed rest. Rationale: to gradually increase the patient's tolerance to physical activity, to prevent asthma attacks by allowing the patients to pace the activity and to have rest periods. Intervention. Teach deep breathing exercises and relaxation techniques. Provide adequate ventilation in the room. Rationale: to allow the patient to relax while at rest and to facilitate effective stress management, and also allow enough oxygenation in the room. Intervention. Refer the patient to physiotherapy, occupational therapy as required. Rationale: to provide a more specialized care for the patient in terms of helping them build confidence in increasing daily physical activity. This concludes our presentation, Nursing Diagnosis and Nursing Care Plans for Asthma. I would encourage you to visit nursestudy.net. We have five care plans and diagnoses on that article. Just go to nursestudy.net and type asthma in the search box and you'll find them. Have a really good week. This is Anna at Nurse Study saying goodbye.